Yeah, I'm good. You
Okay.
good?
Yeah.
All right.
Okay, everybody, welcome back to the KCCMH. Oh, the camera's over there. Welcome back to the KCCMH Connection podcast. Today, we're talking about something essential to rural healthcare: our partnership with local EMS. EMS operates separately from the hospital, but we work side by side every single day when they bring us patients to our emergency department and when they transport patients to other facilities of higher care. Today, we're joined by the new EMS Director of Kit Carson County EMS, and we're excited to learn more about his vision, his team, and his strong how strong EMS hospital collaboration can improve community care. So, welcome, Shane.
Thank you. Glad to be here.
Yeah, so for listeners who haven't had a chance to meet you, can you introduce yourself? Tell us a little bit about your background. Maybe I know you're not from Kit Carson County, so how'd you come out here?
Yeah, so my name's Shane Dixon. I'm the new EMS Director for Kit Carson County Ambulance Service. Yeah, I didn't start out here. I'm glad to be out here now. I actually started my EMS career back when I was 15 years old. I started at Elk Creek Fire Department in Conifer through their Fire Explorer program. So it was a good way for youth to kind of learn about the service and everything. And going into that, I thought it was going to be fire, that it was going to be my passion. Just like most fire departments, it's pretty much 80% medical, and then the rest is just, car accidents and once in a while fires. But my passion for EMS started that way. So I started when I was 15. When I turned 16, I was able to get my first responder. And start doing some calls with them and get that patient interaction. And then when I turned 18, got my first EMT. So did that through Red Rocks Community College there. And then I kind of took a turn. Front range medicine is a lot different than what we have out here.
Absolutely.
And it can burn you out pretty quick. So then I kind of took a break for a while after that and went truck driving. And that's what kind of got me out this way. Is I did that for 10 years. Hauling cattle, everything else out this way. And then found that I should try medicine out again. Unfortunately, I had to get my EMT again because just like everything, if you don't use it, you lose it. So I had to get my EMT and got it back through here. Got my EMT, then got my advanced EMT. And I love rural medicine, and I love this community and what I've done here. So
how long have you been with the KCCEMS?
So I've been here 3.5 years. And then, so I got my EMT and then got my advanced EMT. And then, just as of the 15th of this month, I'm the director. So.
Awesome. So as the director, and I know it's new to you, what does like a day-to-day operations look like for you?
It depends upon the day, really. But it's just a matter of doing all the paperwork, making sure my team gets what they need, make sure equipment's working adequately. And then it depends upon weather, how busy we are too, right? And one day we might not have as much to do and we're doing a lot of training and stuff that way. But then some days we're out all day. So it just depends.
Because as the director, not only do you do all the paperwork and billing, you are also still running calls?
Yep, still running calls too.
Awesome.
Yep.
So what are some of the challenges that come with running a service in a rural area?
So, it's a rural area. We only have 6 full-time staff members at this point. The rest is taken by reserves and everything, which a lot of those people have full-time jobs. And then just sign up when they can. And sometimes they'll even step away from their job to help us if it's something big. But that's a big thing. Like you go to the front range and they have ambulance, but they also have fire department to go on every call. So you have plenty of hands to take care of whatever situation is dealt to you there. Out here, we don't have that. We do have a fire department that will come if we need them, but they're all volunteer too. So they're not available at all times. And then we don't have the Trauma 1 center out here that you do in the front range. So a lot of our critical patients have to be taken to the front range after we get them here and stabilized.
Yeah. So I guess that is a good transition into how EMS works with the hospital. So what's it look like when you hand us off a patient?
I will say over the past couple of years, it's been a lot better because we got that TNT group down there now that we work hand in hand with them really well. And our transition and handoffs to that team is awesome. So we collaborate. I mean, a lot of times we'll drop a patient off and then we help them in the ER to kind of get things done quickly, so they can work on stabilizing that patient. And then eventually we end up having to ship them if they're critical. So
do you think that benefits our patient when the EMS stays in the emergency department? It keeps that continuity of care?
I think it does. Yeah. There's a lot of times that there's a lot of things going at once really quickly. So whether it be helping them to get an IV or running labs to the lab from or blood draws to the lab, just to kind of help them have an extra set of hands so we can get a lot of things done.
Yeah. So something that's kind of been an emerging area of importance to the hospital is interfacility transports. And I know that there's some confusion on it about whose responsibility it is and how we make those calls. And I know it's very complicated, but can you tell us your role or your service's role in interfacility transports?
Yeah. So, I mean, with us being here and in Burlington, also Stratton is our two stations. We're kind of the first point of contact for an interfacility transport. And for those that don't know what interfacility transport that means is this is considered a critical access hospital here. So anything that's high acuity or needs surgical intervention. I mean, there is surgery here, but we're talking like emergent kind of surgical interventions and stuff like that.
So it's like strokes,
Yep.
heart attacks,
Yep.
certain bone breaks, anything that involves the brain or the spine. So major things that need a higher level of
Mhm.
care.
We need to transport them to that facility. So then essentially the hospital gets in contact with them, they accept them, and then it's essentially a transition at that point. So we're 2.5 hours from the nearest transport. So there's two ways to do that. You can either go ground ambulance or go by flights. And there is some patients that definitely need to be by flight because of the critical, and you have a critical care team that can come and get them. And it's a lot quicker for them to fly them there. But we like to try to get as many by ground just because the cost is a lot more affordable that way for our community. But then we have to transport them to whatever hospital. I mean, we transport patients to the Springs, to those hospitals, to Denver Front Range, and even up north, up to around Fort Collins even too. And then once in a while we go into Kansas with some of them. That's more of like a patient preference in that aspect. But yeah, but that takes a team of ours out of the county for 2.5 hours one way. So I mean, it's at least 5 hours that we have a team out. But unfortunately, our number one priority is 911. We have to have teams to cover 911. We can't just take everybody out because then if there's 911, we don't have anybody to cover that. So
yeah, that was kind of my follow-up question is how do you see navigating 911 calls and interfacility transport?
So that relies on our reserves quite a bit because we have to keep our 911 coverage, and then we try to incorporate one of our reserves because a lot of times we might have a provider to take care for that patient, but we might not have a driver, or we have a driver but not a provider. So it's just trying to figure that out. And a lot of times, I mean, it doesn't happen at inopportune times. It might be 2 a.m. We're trying to call people to wake them up to do it. But we're trying to come up with plans to get more people involved, get more people signed up on the service so we have more players in the game, essentially.
So I believe I've seen on your Facebook page that your service is offering an EMT class.
Yes, we just started about a week and a half ago.
Okay.
We have, I think, 8 in this class.
Awesome.
Yeah, I'd love for more, but it didn't work out at this one. But we're trying to do 2 a year. So we're trying to do one in the springtime, or this one's going a little earlier than springtime this year, and then we try to do one in the fall.
So if a person was interested in helping EMS but doesn't like, when you think of EMS, blood and guts and whatnot, can they be a driver or?
Yeah, absolutely. Yes, absolutely. We love any driver that can help us, and there's no like real requirement, like they can pick up here and there if they want to. I mean, we ask that you try to at least pick up maybe once a month or something if you can. But yeah, certainly a driver where you at least have to have your CPR and certification to be with us, and a driver's license, of course. But other than that, yeah, if you just wanted to be a driver, great. If you want to come with us and then get your EMT, I mean, we will cover all that to get you trained in what you want to do.
Oh, that's awesome.
Yeah.
So, Back to interfacility transports real quick. Do you see in the future, I because there's always rumors about, the relationship between the hospital and EMS, and of course there's always some truth rooted in rumors, but now that you're the director, do you see our relationship changing or strengthening, or like are you hopeful for a
I
strong
am
partnership?
certainly hopeful for it. I just met with Brian Bogle yesterday
Mhm.
to kind of start that conversation. I think the big thing is just communication. I think we all have the same goal for our communities to get them out and get them the care that they need. So it's just going to be a team effort on both sides to come up with a good plan to try to improve that interfacility transport and just overall patient care.
Yeah, because you guys, your team is very important to us. You bring us patients, and then you take our patients to the next level of care. So, our relationship with you guys is really critical to, I think, higher patient outcomes, better
Absolutely.
patient outcomes. Yeah. All right. So let's see. What else? What else you want to tell us about your department?
We're just trying to improve every day. We're trying to get trainings. We just had a trauma meeting yesterday with the hospital too. So we're going to try to incorporate some trainings with the hospital because you guys have a wonderful sim lab here to do more trainings that way. So I feel like if we improve with our training and our skills, it overall shows in the community.
So what does your partnership with Stratton look like? Are they I know they're part of your organization, but is it a different group? Like what's that look like?
Yeah, so we have two full-time providers in Stratton now. The nice thing about Stratton is they live there. So at night, we have a 7-minute response time that is by the state and recorded for us to get to the station to run on a call. Um, there's no living quarters over in Stratton currently. That might be something later on down the road. But so they live there in Stratton, so they can respond. So it makes it easy for that aspect. But there is no divide between Stratton and Burlington. We're the same department. We do trainings together, and we're hoping that we can move and swap back and forth and do some coverage that way, so we can work with different teams, and so we all know how we kind of work on a scene and can work in unison. So
Awesome. So I myself am familiar with rural EMS
yep,
as an EMT for community ambulance,
yep,
which is the service that covers the west end of our county.
right.
So do you see collaboration with them or strengthening a partnership there?
Absolutely. There's already been some conversations with Jasmine and Ryan about getting together and starting to try to maybe do some trainings together. We definitely need to get some tabletop stuff for maybe some MCIs. Heaven forbid that happens, but it's better to be prepared than not.
MCI would be a mass
Yes,
casualty.
sorry.
Oh my gosh, our camera's way out of focus.
No.
That's all right. A mass casualty incident like a tornado or a big like a dirt storm or something
Yep.
like that that requires multiple agencies to respond. So training together could be very helpful on that.
Absolutely. Because we also kind of have a newer OEM, Nathan Graham.
Oh,
So
right, yes.
uh, he wants to definitely get one together too and get one under his belt so we can maybe do a tabletop here in the future. So
Very cool. So, since you did talk about your team, that staffing is kind of obstacle sometimes. How will you balance your team's like wellness and work?
yeah, so that is the name of the game there. We got to just work as a team to when somebody's sick or something, somebody step up and cover. Or there is times where we have to just have one team where it might be Burlington that has to cover our deal or our entire responding area. But just communication with the team to see how they're doing, if they're getting overworked or everything, maybe get them to step back a little bit. And then hopefully this EMT class gets us a few more providers that we can kind of shuffle into the mix. We're getting applications frequently that hopefully we can get them in the mix too and have enough that we have a good reserve pool to replace if we need to.
Yeah, because we know even though our call volume out here isn't as high as the city, we still experience the same kind of traumatic calls that can cause burnout and mental health problems. So
Absolutely.
it's very cool that you have a plan to kind of mitigate
Yeah.
those things. All right, so looking into the future, What innovations or challenges do you think could improve the EMS or EMS hospital partnership or just rural EMS overall?
So I think the big thing is, like we've touched on, training. I think if we all train together and prepare for the worst, we're ready for the worst, essentially. So just constantly trying to improve ourselves to answer the call, I think is going to be important. And then just communication too, and figuring out how to solve this interfacility transport issue, staffing issue, everything else. But I think it'll work out in the end, I think.
So, as we wrap up, what excites you most about the future of EMS in our region?
Touch on that again, like just the training, improving our team, hopefully getting more ALS providers out this way so we have that advanced life support versus our BLS. And I think it'll be good. I think I look forward to what we can be. It's just a matter of getting in the right direction. I think we already started that.
Yeah, so you feel like
You were able to take over the department. It has a strong foundation to begin with. And
Absolutely.
You're excited to continue building on that?
Yep.
Cool. All right. So, finally, for listeners, if they could remember one thing from today's conversation with our new EMS director, what would that be?
That my door is always open. If anyone has any concerns or suggestions, certainly come my way. I am open and I'm all ears. I want the community, the workers in the community, the hospital, I want everybody to trust that I am the right person for the job. So if there's anything I can do to help, kind of solidify that, absolutely come my way.
cool. So if people would like to learn more about KCCEMS, how can they?
So you can certainly come in. We can have a conversation. You can email me, call me. We're going to try to do more social media wise as far as what we're doing day to day. Get out in the community, more community outreach, I think is important. So I hope that within the next few months that you get to start to see what KCCEMS is all about.
Yeah, awesome. Well, thank you so much, Shane, for coming in and talking to us today.
Absolutely.
We're very excited to continue growing our relationship with KCCMS. I do think, to dispel some rumors, the hospital and the ambulance department do have a strong partnership.
Yeah.
And like with any kind of family, there's always sometimes some rough spots, but like honestly, I'd say we're bros, right?
Yeah, we're bros.
Yes.
We're bros.
Okay. So, we're just going to keep working on that relationship and making sure that that relationship builds strong outcomes for our patients and that we just all work together to take the very best care of everybody. And so, again, thank you guys. I don't know
thank
what's
you.
going on with the camera today, but thank you for joining us on the KCCMH
Yeah, thanks for having me.
Connection. Don't forget, like,
We're back. Yay.
For the ending, we're back.
yeah, so like, subscribe, share this podcast. If you have ideas or there's a provider in our hospital or our area that you're interested in hearing from, give us a shout out. But again, thanks, Shane.
Thank you.
Good luck.
Yeah.
Nice meeting you.
Nice meeting you.
Thank you.